Welcome to the session on magnitude of blindness and estimating eye care need for a given service or project area. At the end of the session, you will be able to describe service area, prevalence and incidence, cataract surgical rate, and to calculate the potential need for eye care in the given service area. As a project manager, it is important that you get an understanding of any published literature on the magnitude of blindness of a state or country where you are going to implement the project. This will help you in planning and designing the project service delivery effectively to meet the needs of the target population. For any project, we need to have a service area, and hence it is important to understand what is service area. For any eye care provider, there will be a service area, village or town, etc., from where the patient used to access eye care. This is predominantly decided by the close access of the service provider in terms of distance, quality of service by the service provider, and trust factor. To fix the service area practically, one suggestion is it can be of 1 hour to 1.5 hours of travel from the patient location to service provider. Magnitude is the measure of the size of the problem, disease or health condition. For example, World Health Organization projected 76 million of the world population will be blind in the year 2020. There are two key measures relating to magnitude. They are prevalence and incidence. Prevalence. Prevalence is the proportion of people with a disease or condition in a population at a given period of time. This is calculated by dividing the total number of cases in a defined area at a specific point in time by the total population in the same area at the same point in time. Prevalence is usually estimated through scientifically designed research studies. Usually, we use the latest published study as a reference for prevalence. Incidence. Incidence is the proportion of new cases in a given time period in a given population. This will give us an idea about the new occurrence of a condition or disease in a population from time to time. Both prevalence and incidence provide an idea about the need of eye care relating to a particular problem. And this information will be very useful while planning the project activities. Cataract surgical rate is a globally accepted indicator for cataract surgery performance. Cataract surgery rate is the number of cataract surgeries performed per million population per year in the service area. Cataract surgical rate is considered as a proxy indicator for the amount of eye care service delivery in a given population. In order to arrive at cataract surgical rate, you need to have the total cataract surgeries currently done for that geographical area. This is usually published by respective governments and international NGOs periodically. So it helps us to estimate the current amount of eye care delivery in general in our project area. This will be an important information required for proper planning of our project activities. Here is an example to understand CSR in detail. The service area 1 covers a population of 3 million and perform 3,600 cataract surgeries. Similarly, service area 2 covers a population of 2 million and perform 3,000 cataract surgeries. If you look at the number of surgeries done in service area 1 seems to be more. But when you look at the cataract surgical rate, service area 2 seems to be performing well. Hence, it is important for you to look at cataract surgical rate to really understand the impact created in that particular area in terms of eye care. In most African countries, the CSR is less than 500. Hence, it is important to aim at least 3,000 CSR every year. For China, it is good to aim at 5,000 CSR per year, and in India, to aim somewhere around 6,000 to 9,000 CSR based on the existing performance. Using this, the funding agency or the project manager will be able to estimate the unmet need for eye care in the project area. In any population across the globe, 20 to 25% of the people need some form of eye care. The proportion of various eye conditions may vary from country to country. To calculate the potential need for eye care, we are taking 100,000 population as an example, and we use a rule of thumb based on various studies and work at Aravind to explain this. Applying the potential CSR of 10,000, the number of cataract surgeries to be done for every 100,000 population is 1,000 per year. It is reasonable that every eye care provider can aim at least 6,000 CSR, which is 600 surgeries for 100,000 population every year. Similarly, 20% of the population is estimated to have need for refractive error service, which is 20,000 for 100,000 population. However, only around 20% of those people who need refractive error services were actually receiving glasses. Those who wear also need to change their glasses at least once in every 5 years due to breakage, change in power, or towards fashion. Considering all these aspects, 4,000 spectacles can be fixed as an annual target for a population of 100,000. Another major cause of blindness, as listed by WHO, is glaucoma. It is estimated that 1% of the population will need glaucoma services. The number of patients will be 1,000 for a population of 100,000 people. Similarly, 3% of people is estimated to be diabetic and 15% of them estimated to have diabetic retinopathy of varying severity. It is important for diabetic patients to undergo eye examination at least once in every year to prevent vision loss due to diabetic retinopathy. This slide gives you the prevalence of diabetic in the 20 plus population. The data source is World Diabetic Atlas. Of the total diabetic, 12 to 15% have some form of diabetic retinopathy. Similarly, the prevalence of glaucoma in 40 plus population is listed here. The reality is less than 50% of them were diagnosed, and for those who are diagnosed, a lifelong follow-up is needed to retain the vision. Another important information we need for planning is the age profile of the population. Since the eye care need is different for people at different age group, the age profile helps us in fixing the targets and designing the services more appropriately. For example, 20% of Indian population is in 50 plus age group, whereas when we take Kenya, it is only 10% of the population is above the age of 50 years. Similarly, the proportion of children aged less than 15 in a population helps us in planning the school eye health programs and pediatric eye care services. We are sharing with you a template for estimating eye care need along with prevalence, incidence and CSR for your respective countries. By plugging in your project area population along with the relevant data on eye care need and CSR for your country, you will be able to estimate the need for your various services in your project area. Based on this, you will be able to set appropriate targets for your project. If you are not having the country specific data, please use the rule of thumb. Add the current service delivery in numbers, plan your targets, present it and share it with us for any queries. Achieving the targets depend upon how you work around the key components such as access, infrastructure, human resources, supply chain, service delivery, promotional activities and follow-up. You will be discussing each of these aspects in detail with the respective faculty during the course of this training. Thank you.